William Harry Barnes, born 1887, died 1945. African-American otolaryngologist, surgeon, and inventor. Dr. William Harry Barnes was a distinguished ear, nose, and throat specialist who invented an instrument to facilitate reaching the pituitary gland surgically. He was chief otolaryngologist at Frederick Douglass Hospital in Philadelphia, and as a diplomat of the American Board of Otolaryngology. He was the first black to become a board-certified specialist. Barnes was active in the National Medical Association, an organization of black doctors, dentists, and pharmacists, and served as its 37th president from 1935 to 1936. Barnes was born on April 4, 1887, in Philadelphia, Pennsylvania, and spent nearly his entire life in that city. He grew up in a poor neighborhood, and his parents worked at menial jobs to support him and his two sisters. During high school, he walked 10 miles a day to school and work because he couldn't afford the trolley. His family and friends ridiculed his idea of becoming a doctor, but they were not aware of his fierce determination to rise out of poverty and to pursue a career as a professional. After graduating from Philadelphia's Central High School in 1908, Barnes spent the summer preparing for the University of Pennsylvania Medical School scholarship exam. He won the scholarship, becoming the first black to do so. He received his M.D. in 1912 and interned at Douglas and Mercy hospitals the following year, with a specialty in ear, nose, and throat. Douglas Hospital appointed him assistant otolaryngologist in 1913. In 1918, he served in the U.S. Public Health Service as an acting assistant surgeon. In 1921, having completed 7 years of clinical experience, Barnes returned to the University of Pennsylvania to do postgraduate work in ear, nose, and throat treatment and surgery. He desired further advanced training but couldn't find it in the United States, so he went to France in 1924 to study at the University of Paris and the University of Bordeaux. Later in the United States, the renowned Dr. Chevalier Jackson of Philadelphia also served as Barnes's mentor, teaching him to use the bronchoscope device used for inspecting the bronchial tubes. The first black to master bronchoscopy. Barnes set up a department of bronchoscopy at Mercy Hospital. In 1931, he accepted a teaching position in bronchoscopy at Howard University Medical School in Washington, D.C. Barnes was an inventor in his field. His invention of the hypophyscope, an instrument used to visualize the pituitary gland through the sphenoid sinus, made him famous. His accomplishments included other innovative operative techniques, as well as a streamlined, efficient medical record system. Barnes was very active in the National Medical Association, for which he presented papers and gave demonstrations. One such demonstration showed the speedy and bloodless technique of his 10 minute tonsillectomy. 10 minute tonsillectomy. 10-minute or 10 minute tonsillectomy. He became the president of the association in 1935. Barnes was also one of the founders of the Society for the Promotion of Negro Specialists in Medicine. Among his other affiliations were the American Medical Association and the American Laryngological Association. Locally, he served as president of the Philadelphia Academy of Medicine and Allied Sciences for 3 years. Barnes was married to Mattie E. Thomas in 1912. The couple had 5 sons: W. Harry Barnes, Jr., a mortician; Lloyd T. Barnes, an internist; Ralph W. Barnes, an industrial designer; Leroy T. Barnes, a radiologist; and Carl L. Barnes. In 1938, Barnes began to suffer from hypertension, and in 1943 he incurred a spinal injury with paraplegia. He later died of bronchial pneumonia on January 15, 1945, at the age of 58. His obituary in the March 1945 Journal of the National Medical Association paid tribute to him as a nationally recognized ear, nose, and throat specialist whose, quote, ability as a diagnostician and surgeon was equaled by few and surpassed by none. Unquote. Citations and sources of this audio are listed below.